Hey mama, welcome to Parently. I'm Annabelle, and today I'm talking to you about Caesarean section. Caesarean section is also known as C-section. And you're wondering, why do I need to know about C-section? Well, let's talk about the statistics. And you're not just a number, but statistics do show that 1 in 3 women will go for C-section. So it might be you. And so we apparently want you to be completely empowered, know everything that there is to know that you can know about what could happen to you on that delivery day. But I want you to hold on because at the end of the video, we're going to talk to Jess. And Jess had a C-section and she wasn't really planning on it for her first baby. And we want to see, did her doctor talk to her about all these things and prepare her for a C-section? So you get to the hospital. And some women do go for an elected C-section. Now, elective C-section, some doctors say, okay, yeah, you can schedule your C-section, and some say, no, I'm not going to allow you to just decide that you want a C-section when you have no risk factors. So you have to figure out, ask your doctor if he will do an elective C-section. But there are also emergency C-sections. That means that you're at the hospital, and for some reason, the benefit of taking you to surgery outweighs the benefit of allowing you to continue to labor and deliver vaginally. And then there are also the women that in a previous pregnancy had a C-section for some reason, and now they're pregnant again. And their doctor, your doctor maybe, will talk to you about a VBAC, a vaginal birth after C-section. And that means that you're pregnant, they're saying, okay, do you want to go to the hospital and attempt to labor and deliver vaginally after you've had a C-section in the past? Or do you want to elect to have a C-section for this baby that you are currently pregnant with? So those are all options, and you need to start looking at your healthcare provider, talk to them, say, okay, what are my options? The hospital that I'm going to, what are those options that I will have at that hospital? Now, I told you that 1 in 3 women will go for C-section. That is a statistic that is all hospitals, all doctors, all women in the United States combined. But you need to look specifically at your doctor because some doctors have higher rates of C-sections than other doctors. Some hospitals have higher rates of C-section than others. So you need to go to your doctor and say, what is your rate of C-section? If it's low, then you say, okay, I'll probably be okay. If it's really high and you don't want a C-section, you might need to consider going to a different doctor. So definitely know your healthcare provider's rate of C-section. If you're going to a midwife, well, then you need to probably go to the hospital and see the doctors that are on call there. What is their rate of C-section? Because your midwife is not going to be giving you a C-section. She is not a surgeon, and so she will only deliver your baby vaginally, not by surgery. So I'm talking about surgery, and that is what a C-section is. And I know that word's scary because you're thinking, I just want to have a baby. I don't want to go to a major surgery. So let's talk a little bit about what it entails and why they would do it. So say you're a high-risk pregnant woman, you have twins, maybe you have twins inside of you, that would mean that you're probably going to go for C-section. Say you have really high blood pressure, you might go for C-section. Say your mom had a C-section and it looks like you've got a very small frame, your baby's way too big, you might go for a C-section. Say you're at the hospital and you're laboring and all of a sudden, labor doesn't progress anymore. The cervix no longer is dilating. It's not opening up so that your baby's head and then body can deliver through the birth canal. So you have an arrest of labor and you've been laboring for a very long time. The doctor might take you for C-section for the safety of you and your baby. Say you're in labor and your baby's heart rate just keeps dropping, called decelerations, and you have a contraction and then the contraction stops, and then all of a sudden the heart rate is dipping. They might take you for C-section if your placenta is not perfusing enough blood. So these are all reasons that you might and undergo a C-section. So you're at the hospital and the doctor comes to you or the nurse and says, okay, you need to go for C-section. And all this is coming at you. You were not expecting it. That's when you need to slow down and say, okay, I need to ask some questions. And if you are not capable of doing that and you know in advance that that's probably not going to be the case, that you're just not going to be able to ask questions and rationalize and reason correctly, you need to have your husband there with you, and you need to talk to him in advance so that he says, why are we going for C-section? He speaks on behalf of you. He is your advocate. So very important to have your husband there. Make sure he's informed in advance to know all the things that could happen and to be able to ask those questions. So they've got you in your stretcher and they take you to the operating room, and it's time for a C-section. What's going to happen? Well, first, it's very important to realize that the operating room is not as cozy as your laboring room. It's bright, it's sterile, things are echoing, there are people everywhere, and you get kind of scared. Well, don't get scared. It has to be bright and sterile for your safety. The doctors need to be able to see what's going on. The nurses need to see where all the supplies are. They need it to be sterile, which means super, super clean, so that you don't get an infection. So they take you into this room, the operating room. They are going to put you on the operating table. Now, if you had an epidural while you were laboring, they are going to continue to use that epidural for your surgery. If you did not have an epidural, or if the epidural is not working correctly, they will probably do a spinal. So a spinal works very quickly, and you're going to be numb from about the rib cage down. Now, you might feel some heaviness in your rib cage, and that scares some women because they think, I'm not going to be able to breathe. Well, the anesthesiologist knows this, that you're going to have some heaviness, but you still will be able to breathe. It feels a little weird, but you will be able to breathe. They are the anesthesiologist or the nurse anesthetist who is administering this medication to make you go numb. He is monitoring your vital signs. That means he knows what your oxygen level is. He knows what your respiratory rate is. He knows what your blood pressure is and your heart rate. So he knows if you're breathing right or not. So just make sure to stay calm. He's taking care of you. But if you want to ask, don't be afraid to ask. Be in charge of your body, so you can ask those questions. So the only other option is general anesthesia. So general anesthesia means that you go to sleep completely. This does not usually happen unless during the C-section there is major bleeding, or they have to do a hysterectomy, or if there's something that happens that is out of the norm. So you will be awake. You'll just be kind of numb from the chest down. This is good though, because you're undergoing surgery, so you don't want to feel anything. And the anesthesiologist or the nurse anesthetist will make sure that they're communicating with the surgeon and with you to make sure that you are numb. They will not start to cut you until they make sure that you don't feel it, okay? So I know it's super scary to think I'm awake and they're going to make an incision and pull baby out, but they will make sure that you can't feel it. So let's back up a little bit. So they put you on the operating table and they are going to have you lay down, and they want your hands up here. So they might have your arms out like this, or they might have your arms like this to make sure that you don't touch your belly, because what they're going to do is they're going to sterilize. That means that they're going to make it super clean so that there's no chance that you will get bacteria inside of that incision and cause sickness in you. So they're going to lay you back, have your hands up here, and then they're going to scrub everything. Clean, 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 clean. And they're going to say, don't touch it. After it is all scrubbed down by the doctor or the nurse or the tech, whoever is cleaning you, they're going to put a drape on you. This is going to be a blue drape, and it's going to stick on your belly, and they're going to open it up, and there's going to be a little hole where your belly is exposed, but you're not going to see it because that drape is going to come up in front of your face so that you do not see what's going on down below. So you're numbed, you've got your belly's all clean, sterilized, and they have the drape on, and then they're going to possibly ask your husband to come in. He's going to be all scrubbed in, clean, and the doctors are all going to be there, the nurses. There's probably going to be quite a few people in the room with you, and that is okay. They are there to take care of you. So then they're going to make the incision. The incision might be about this big. It's not going to be as big as the baby, so you don't have to worry that it's going to be this ginormous incision. It's so cool because incisions for C-section used to be made diagonally. Think about that one. Diagonally, and now they're made horizontally. So they used to be very big and very obvious up and down a mommy's belly, and now they're making them horizontal down by your underwear line. So they're much more disguised now, and there's so many great surgeons out there that are doing a great job to make sure that your incision is not extremely obvious afterwards. So they're going to make that incision, and they're going to go through several layers: skin, muscle, fat. They're going to get down to your uterus, and they're going to open up your uterus. And if your bag of water did not rupture when you were laboring, say you're in for an elective C-section, or your bag of water just didn't break yet, they're going to break that bag of water, and then they're going to pull baby out. When baby comes out, they're going to stimulate baby, make sure everything's okay, and they're going to clamp the cord. At that point, they're going to cut the cord and take the baby to a warmer. Especially if it was an emergency C-section, they have to make sure that baby is okay. So the nurse is going to be over at the warmer, making sure that baby is stimulated, make sure that the baby's APGAR scores, which means that the baby is breathing right and it has good reflexes. They're going to make sure that baby is okay and does not need emergency care in the NICU. Once they make sure that baby's okay and the dad can be over at the warmer watching, they're going to bring baby to mama. And mama, you get to, I know that you're laying there and you're numb and you don't have a lot of chest space, but you still get to touch baby and hold baby in those moments. Because it does take a little while, once baby comes out, for the surgeon to start stitching you back up. He's going to place sutures, and that takes a few minutes. Some surgeons are super quick, and it might be 30 minutes. Dr. Boyd, his C-section time usually was about 30 minutes, but some doctors, it does take up to an hour or so, and it also depends on how your bleeding is controlled, if the placenta, all the parts of the placenta came out, if the uterus is contracting. So there are variables, but with no complications, it shouldn't take too long. Once you're all sutured up and baby is okay, they're going to take you to the recovery room. You're going to stay in the recovery room depending on if you're stable or not, maybe an hour, maybe more. They're just going to monitor you, make sure that all of your blood pressure, your respiratory rate, your oxygen, make sure that the anesthesia is, wearing off and that you're starting to get a little bit of feeling. They're also, at this point, going to be taking you to your postpartum room. Now, you did have a Foley catheter placed when you either had your epidural placed or when they took you for C-section. And the Foley catheter drains the urine out of your bladder because when you're numb, you can't urinate on your own, and they have to make sure that you don't get an infection so that your bladder is empty. So that Foley catheter will go with you to your recovery room, and later that day, your nurse will remove it. She will be checking on your incision, making sure that it's staying clean. They're going to make sure that your anesthesia is wearing off, and later that day, maybe the next morning, but it's usually later that day, the nurse and the nurse anesthetist and a tech will help you get out of bed. They want to get you walking because when you stay in that bed, you're at risk for a whole lot of different things. So they want to get you up and get you walking. And from there, your recovery is the same as if you had a vaginal delivery. And we talk about that in other videos. So we are talking about C-section today, and we want to talk to Miss Jess, who did have a C-section, and she wasn't really expecting it on her first baby. And then on her second baby, she decided, I don't want to have a VBAC, I'm going to go for another C-section. So let's talk to Jess and see if her doctor really prepared her for what was to come.
Yeah, so I am a mom of two beautiful boys, and I had two C-sections. So the first one was unplanned, and the second one was planned. So I kind of have been down the road for both. And I know that if you're a first-time mom, C-sections can sound a little bit daunting or frightening because they kind of just have that, negative connotation to them. But to be, and I totally understand that every mom has a different experience with it, but for me personally, it was okay. It wasn't anything that I, could say was harder to recover. And obviously I don't know having a vaginal birth. I don't know what that experience is, but just from talking to other moms, it didn't seem at the time that it was anything that was more painful or, recovery wise. I didn't feel like I had anything more that I had to get over.
Okay, so tell us a little bit about how did your first C-section come to happen? Was it did you want a C-section, or did that just happen emergent? What was your first C-section circumstances?
So with my first son, I went into labor. He was 5 days after the due date. I started to have contractions, and we had actually planned an induction for the morning that I actually ended up going to the hospital that same morning, just a little earlier than was planned, because I started going into labor on my own. And so labor was kind of naturally progressing, but it wasn't happening quick enough. And so they had given me some Pitocin to kind of induce it. And my son started kind of having trouble with each contraction that I had. They realized that his heart rate was dropping. And so we were monitoring that, which was really scary in and of itself, because we would hear his heartbeat, then I'd have a contraction, and it was almost like, you couldn't hear anything. And so it was really worrisome for a first-time mom. That was our primary concern at that time. And so the doctors were monitoring it. They were trying to see, I wasn't like dilating as quickly as, they had wanted. And they were fearful that maybe the cord was wrapped around his neck. And so the doctor came in. I think I had gotten up to 7 centimeters dilated at the time. And so at that point, they decided that a C-section was the best option because of his heart rate. And so what I can tell you is that at that point, even though during the whole 9 months of pregnancy, you're fearful of that, decision being made for you, I wasn't. At that point, it was just like, I wanted for my baby to be born. I wanted him healthy. I didn't want any risk. And so I just went with it, and I said, yes. I said, do what you have to do. And so the fear of the C-section was no longer what was, present in my mind. It was the fear of my baby. And so I was, like, let's do whatever we have to do to get him out healthy. And so that's what we did. And so that was the next step. And they prepped me for a C-section. And my husband was there with me. Actually, my parents and my in-laws were waiting in the waiting room. And so we told them the news that I was going to, go in for a C-section. My mom is actually, she had me and my 2 brothers be a C-section. So she's kind of like a veteran of the C-section world. And so she came in and calmed me down and, said, don't worry, it's going to be fine. I had great experiences with C-sections, and they wheeled me in, and my son was born via C-section.
Great. So, a couple things there. You mentioned that your mom had a C-section with you. And for our moms watching, that is something that is important for you to tell your doctor, because statistically that is true. We want to know your mom's obstetrical history, because if she had a C-section, you might be at an increased risk for having a C-section as well. And so I don't know if your doctor talked to you about that, but did your doctor talk to you about C-section before that day even came? Was it something that he said, you might have a C-section, or let me tell you, if you are to have a C-section, this is what to expect?
To be honest, I don't think that we ever had a real conversation about C-sections. It was something that I kind of looked into my own, and I knew that it was out there and it was a possibility. But we didn't talk in detail about what that would entail, or, what recovery would look like, or what the whole procedure would be. And so I guess it kind of felt like I went into it blindly. But like I said, at that time, it was just like my focus was on my son. And so nothing else mattered,
Absolutely, yeah. And I think every mom would have that instinct. You are in the care of healthcare providers that know what they're doing, and you were trusting them, and you said, yes, take care of my baby. And I think that is where every mom would be. I think for us, we want moms to know, okay, this could happen, and what do you expect? The operating room can be scary for a lot of women. It's not as cozy as the labor room. And so to understand that this could happen, 1 in 3 women do end up going for C-section, which, statistically, that's not exactly a low number. And so the more moms that we can say, you're not absolutely going to go for C-section, but you might. So here's what to expect. So let's talk a little bit about the recovery. So the C-section happened. When did you get to hold baby? How did you feel after?
So strangely, maybe this is the case for all moms, but both of my C-sections were very different. So with my first, so I had him, we didn't know what we were having. So that was exciting. So he came out and they said, it's a boy, and they put him on the scale. And then to be honest, it's kind of just like a whirlwind. So they started working on him, where with my second son, we knew what we were having. So they said, it's a boy, confirmed it. And they immediately gave him to my husband. And so my husband was seated next to me. And so I could see him, and he was really able to do that initial bonding with my son. And I wish it could have happened with my first son, but it didn't. So it was really different. So with my first son, they worked on him, and then when they were going to wheel me back into the recovery room, they placed him on my arms because I obviously couldn't really hold him on my own. So I remember they placed him down, and we have pictures of it, and they wheeled us to the recovery room. And that was when I first really got to hold him. Where with my second son, my husband did that initial bonding with him, which was great. And it made me feel a lot more at ease because I knew he was with one of us.
Okay, awesome. Yeah. And so tell me a little bit about the recovery. How did your incision feel? You go home taking care of your incision. Was it anything burdensome, or were you just like, okay, this is the incision that I have, I'm going to take care of it? How was your pain?
Yeah. So like I said, I don't know how to compare it to having a vaginal birth. So if I'm talking just, what I know is what I went through, right? And so it was painful, but it didn't seem like something like, oh my gosh, I can't believe I had to go through this. I could never go through this again. I remember the ride home, going over bumps, and you kind of bump up in your seat and you could feel it a little. And we lived in the house that we lived in at the time, the bedrooms were upstairs, so I'd have to go up and down the stairs. So it was really helpful to have my husband. He was off for that first week that we were home. And then my mom and my mother-in-law kind of came in when they could, and they would help out. Definitely having people to, help you in and out of bed, picking up my son. So my husband would get up in the middle of the night for the feedings, and he would hand them to me, at least for that first week, because it's I guess putting the strain of getting in and out of bed and going up and down, it's painful, but it's not something that you can't take. So, and then with my second son, I had a 3.5-year-old at the time. So I remember for that, I was doing a lot more the second time than the first time because I had to take care of my son, and I didn't want him to feel like, where's mom? And so you do a lot more the second time around. And I wouldn't say it was more painful, but I think I probably put a little more stress on the incision because I started doing more a lot sooner.
Okay, yeah. And you sound like a trooper. So now you're talking about your second C-section. Some women do choose a VBAC. They choose to deliver vaginally after their first C-section. Tell us a little bit about, it was an elect C-section, or was it, again, something you didn't really know was going to happen?
So, when I got pregnant for the second time, it was a conversation that I had with my doctor. For me, when you're pregnant the first time, I think the C-section is the unknown, and it's the scary thing, and it's what you don't want to happen. And I had already been down that road, so for me, it was familiar. And so I was actually scared of, giving birth vaginally. I didn't know what it would be like. I knew what having a C-section entailed, the process, the recovery. And so for me, it was always the decision, I would just do a C-section the second time around. I thought that it was probably likely that it would happen via C-section the second time around, just given the circumstances of the pregnancy with my first. And so I kind of just said, you know what, this is what I know. This is what I'm comfortable with. Let's schedule it. So we actually scheduled it. My son's due date was October 10th, and the C-section was scheduled for October 4th. But he was actually born September 30th. So I ended up going into labor on my own before the C-section. And I actually called my doctor because I said, you know what, we never really talked about what should I do in the event that I go into labor before this date. And so I called them and told them like how far apart my contractions were coming. And they asked, they said, did you change your mind? Do you think you want to go vaginally? And I said, no, I think I still want to have the C-section. And so at that point they were like an average of like 7 minutes apart. So they said, why don't you start coming on in? And so I did. And so he was born via C-section. It was planned, but it was still even earlier than planned.
Okay, yeah. So for you mamas watching, things to consider with your first pregnancy and your second. C-section, vaginal delivery. Should I try to labor without going for a C-section? So lots of different options here, and we definitely encourage you to talk to your healthcare provider about all of your different options. I definitely want you to click the link below and go to Jess's blog. It's Mama of Both Worlds. Great blog. She just talks about lots of different stuff. She also talks about how to be a mom and work at the same time. So definitely click that link. Thank you so much, Jess, for talking about your C-sections today.